Thereforcare is brought to you by CareScout with the goal of sharing real-life conversations about aging care. Views expressed on this program are the speaker's own. We don't provide medical, legal, tax, financial, or other professional advice. Always talk to your own professional advisors for advice tailored to your needs. Today's guest is Jennifer Johnson, Director of Operations at CareScout.
My parents came to visit me for 6 weeks and stayed with me in Florida, which I thought was eye-opening to see how much his disease had advanced. I had to talk to my mother and say, wow, this is a lot. On top of it, her having some physical limitations is just a bit of a recipe for disaster.
How did those conversations go? Because, when you bring family into it, it can be challenging to bring up those subjects.
Initially, it was met with, I can do this. We probably had to have the conversation 4 or 5 times in small increments. And I relocated about 2 years ago to Central Florida. Now, thousands of miles in between us, putting a real strain on my ability to check in on them. My brother now took on more of the full-time role. It's kind of a little bit of a partnership between him and I, where I still feel like he's doing the majority of the work, but I'm contributing in the way that I can.
Welcome to Thereforcare by CareScout, a podcast all about aging care, whether you're navigating it for yourself or a loved one. My name is Katy Boyles, and I am joined today by Jennifer Johnson. Jennifer has over 20 years experience as a registered nurse in the field of aging care, and she also has the personal experience of being a long-distance caregiver to her father. Today, we are going to talk all about the family dynamic and challenges that come for caring for a loved one. Jennifer, I'm so happy to have you here.
Good to be here. Thanks for having me.
And can you tell us a little bit about your background as a nurse in the aging care space?
Sure. I started out my journey working in the hospital and then moved into rehab facilities and extended care facilities. Most recently, I spent a lot of time doing home care and case management for folks who were coming out of the hospital and returning to their home setting.
And I know that we've talked a little bit about this. You used to live near your family, but recently moved.
Yeah, that's right. So I was about 7 minutes away from my parents, and I had a strong presence in their day-to-day, talked to them all the time. And then I relocated about 2 years ago to Central Florida. So now thousands of miles in between us, putting a real strain on my ability to check in on them in person.
And who specifically were you checking in on during that time and caring before you had moved?
A little bit of both. So my father has advanced dementia, and it was certainly progressing before I left. And my mom has a few physical issues that come and go. So she's got some back issues that sometimes it's going okay and she's completely functional. And then other times she has a lot of trouble walking and a lot of pain. So I was checking in on both of them. But the more pressing issue is with my father.
Your father. And some of that came up recently, didn't it?
It did. So while we knew he was having trouble with his memory and there was some confusion, they came to visit me for 6 weeks and stayed with me in Florida, which I thought was going to be an awesome time for us to connect. But really, it was eye-opening to see how much his disease had advanced and how confused he really was. And more importantly, how my mom was struggling to maintain his care.
And when you're talking about those changes, what was the one that stood out to you that you noticed that things were getting a little bit worse?
Yeah. So he recognized me for sure, knew my name, knew my children's names. But some of the day-to-day, waking up and what does he do next? Finding the bathroom, which was super close in proximity to where he was standing. When it was time to eat, having to redirect him over and over to come to the table. It's time to eat. And then even sitting at the table, convincing him to eat, right? He didn't know what to do next. He would sit and look at the food until someone directed him to get started.
And I imagine since you had moved away, seeing that and being together for 6 weeks was a bit eye-opening. What did you decide to do during that time?
One, I had to talk to my mother and say, wow, this is a lot. I don't think anybody had any idea that they were, the disease was progressing so quickly, and what the amount of work that she was taking on day over day. On top of it, her having some physical limitations, it was just a bit of a recipe for disaster. He's a little bit unsteady on his feet, so he would forget to use his cane. And when he was confused and looking around for the bathroom, as an example, wandering around the house unsteady without a cane, there's a safety risk there, right? And if she's physically unable to follow him, I mean, it's just a recipe for disaster.
And I think what's unique about this situation is for more than 20 years, you have been a nurse in this space. So you have seen it in a clinical sense. Mm-hmm. How is it different navigating that when it is your own family?
It's so different because every minute counts, right? There's every minute of the day, there's something to be done. There's something that she needs to consider. There's something that he could be doing that could be unsafe for him. It doesn't really give her a break. And if she were physically healthy, it would still be hard. But being having the back pain and some of those physical challenges just added to the stress and the strain that she was going through. It caused frustration. I mean, she was really mad at him. And there was also a little bit of a medical impact because she would pick simpler things for meals because it was all up to her to consider what he would eat. And being a borderline diabetic, the easiest thing for her to do was grab a muffin or something, super easy, which wasn't the most appropriate thing for him to be eating, but she didn't feel like she had a choice. So noting those things with my background saying, hey, this could be really bad. We have to have a little bit of discussion, and she has to be on board with learning things that she didn't necessarily have to consider in the past.
And how did those conversations go? Because, when you bring family into it, it can be challenging to bring up those subjects.
Mm-hmm. Well, I'll tell you this, it didn't go well. And we had to have that conversation several times. So my brother, who is in Massachusetts, so he now took on more of the full-time role. He also lives about 5 to 7 minutes away. And so he's at the home every single day, but it's in the evening or afternoons after work. So it's a quick check-in to help solve for medication management and helping with the bills and the yard work and things like that, which was fine for a while. But now we've entered another level, right? Now there are day-to-day needs, there are safety issues that we need to consider. So talking to her the first time and just saying, wow, that's a lot. You are doing a lot, and there are pieces here that are not safe for you and are not safe for him. Initially, it was met with, I'm fine. I can do this. Okay. And so as the days were on, and I was there to help and help support, we had to have the conversation again. Well, today was hard, right? Don't you agree? That was a lot. Maybe he could have fallen here. If I felt like you were really strained there, and you could use some more support in these sorts of ways so that it helps him and helps you at the same time. So we probably had to have the conversation 4 or 5 times in small increments and with examples so that she could really understand what she was up against.
Yes. And I hear now, so you have your mother, your father, your brother helping, you with a background in this. That is a lot of people to balance the emotions involved and how you're going to have those conversations. So how is the experience now that your brother is more involved up there?
Yeah. So it's certainly better because we are proactively engaging with her versus we're maybe more reactive. Like she'll call us if there's an issue. She'll let us know if there's a problem. And the truth was she wouldn't, right? She didn't, I don't know how long they were in that kind of state before I got to see it for myself, right? So we have to be more proactive with it, calling her ahead. Do you need a grocery delivery? What is it that you need? Has the laundry been done? Can we send someone to do that? Are you thinking about personal care? Can we get someone in the house to help him with a bath? That conversation, Katy, we still haven't won that battle. We're still working on it. She insists on still helping him. It's not safe for him or for her, but we are doing our best to help gently convince her that this is a good route for the best interests of both of them.
I think that's helpful advice for other people who are going through this right now, that it's not just one conversation and it's done and everyone's going to be on the same page. This is something that is emotionally charged and can take some time to go through it. So after those 6 weeks together, what were the next steps after that, or how you helped them seek more resources or to just understand the care that he needs better?
Yeah. So one thing was about his nutrition, right? And managing his now more full-blown diabetes, right? And teaching her that it's really important to watch what he's eating. And if she's unable to prepare what fits his dietary needs, then she should seek help, right? And so we came up with that plan where she knew more. She had a list of things that she could do that made sense for his diet. I was able to teach her how to check his blood sugar. Luckily, it's not a daily need, so it's just in the case of an emergency where she'd have to do it. So she felt comfortable with that. And then we came up with a plan of some care coming to the home, some help, some support. These are the ways I can support from afar, making the grocery order and having it delivered, right? Don't worry about it. I'll order it and it'll be delivered to your door. And my brother would be taking care of his pieces. We had to add more individuals to the care circle. Someone else has to maintain the laundry, as an example. I can't do it from afar, and it puts too much strain on my brother to take care of that, in addition to all the other things, the appointments, the lawn care, all the other things that he's in charge of. We don't want to burn him out either. And the last piece was a plan for personal care so that they could both be safe for baths and dressing, and really take a lot of the strain. He had a fall while he was in the shower at my place. I had stepped out of the home for 5 minutes, and she was there with him as he was bathing, and he slipped and fell, and she couldn't get him up. So it was a clear example of the safety issues, but we're still working on that last part of that plan and getting her to accept it, and finding the right fit of caregivers that could come in and support that need.
So it's a lot of coordinating between you and your brother, and then your mom and your dad. Do you have any advice to help other people who are just starting to enter that place where they need to figure out what people can do in different pieces?
Yeah, I'd say have the conversation as early as you can, and maybe consider that it might not go as smoothly as you think, right? There's a sense of loss there, right? That I can't appreciate as much as is needed. So I had to pause and really say to myself, if it were me, how would I feel about knowing that I'm not making the right meals, that I can't keep my husband safe, or things like that. There's a sense of loss there that she needed a little bit of time to process before we could move on to the next thing. So I would say have the conversation early and be open to revisiting it because it's sensitive and it may take some time before you can get on the same page.
Yes. And I imagine it's hard that you do not live there anymore. You are a long distance caregiver. And I know you mentioned putting in the grocery orders. What are some other things that people can do if you are a long distance caregiver so that you still feel like you're contributing and helping out?
Oh, that's a really good question. I ask my brother all the time, what else can I do? Right. And she'll say things like, I need this thing and I'm going to call him and tell him to bring it. No, don't worry about it. I'll send it. Right. And so it's very limiting, right? Because being in person there's so many things that are needed that are in person. But the groceries are a good example. I coordinate the medical appointments, just scheduling them. If there are any questions about medications or anything that the physicians need for information or to share, they'll call me. And so I can kind of keep that medical journal, if you will, and the history of what's going on and where he has to go next. I can keep that up to date. My brother has to be the one to execute on it, though, and actually bring them there. So it's kind of a little bit of a partnership between him and I, where I still feel like he's doing the majority of the work, but I'm contributing in the way that I can to relieve him a little bit.
And you're navigating this for the first time yourself, regardless of the fact that you've been doing this for your career in a clinical sense. Was there anything surprising that you learned throughout this experience?
Yeah, I mean, it was so surprising to me that the pieces that she didn't consider from maybe the medical side, right? And I thought to myself, oh gosh, why would she know that? He's got a great primary care physician who's very involved and takes a lot of time to share information and educate them. She's at all the appointments, and yet as it applies to the day-to-day, the muffin as a great example. Day 1, day 2, day 3 or 4 or 5 of having a muffin for breakfast. I said, I don't know that he should be having that. And she was completely surprised. And then I was completely surprised that she was completely surprised, right? So I think that sometimes in an overwhelming or complicated situation, it's important to repeat or just take additional time to make sure that the understanding is there so that they can apply it to the day-to-day.
And is there any advice you would have for other people experiencing this of something that you tried with your family while navigating that did not work so well?
Yes. Going maybe too hard, too fast, right? So it probably the 3rd day into the visit, I called my brother immediately and said, this is bad. I don't know how they're managing in that house. They live alone, just the 2 of them with a cat, which is a fall risk, right? And so I said, this is really bad. And I don't know how they're managing in that house alone. We've got to do something ASAP. We've got to, move them out, get them, like, just all these really kind of extreme solutions that I thought would be the best solutions ever. And he was on board right away. And we got together with this plan of how we were going to solve it for them. And they said no. Right. And so the reality is they have autonomy, right? They're still individuals. They still get to choose and have to participate in the care. And so I think being demanding or making the choices my choices alone does not work.
Yes. And you said something great about we wanted to fix it for them. And I think a lot of people feel that way, that they want to fix the situation, but really taking into account everybody's perspective and pulling everyone in together to the care circle is helpful.
Absolutely.
And now I want to shift a little bit to talk about more of your background in the healthcare profession. Because, healthcare professionals, they still experience that guilt and having to go through these things in real life. How has this impacted the way that you are now leading throughout your career for other people?
Oh, that's such a good question. I think that what I hadn't considered is what happens when the person goes home, right? What happens when they go home and all the great information that's been provided. Because I think hospitals and other settings like that, they really try to make sure that you have what you need so you can be successful at home. But there are nuances that you or they don't necessarily consider when the person's back at home. There is a lot that happens in between for maybe the primary caregiver that's trying to consume so much information at a time that they're overwhelmed, and all of that information maybe ends up on a table somewhere and isn't really absorbed. So I think for me and the way I would handle a patient interaction differently in the future is go slow, right? Go slow, hit the important areas first, and then pause to make sure that's understood. And we can cover the rest another time, right? Because covering all at once, things will get lost, or it may all get lost by the time they reach their home setting.
And you said to cover the most important areas first. Where would that be? Or is that unique to everybody? Or is there a few areas where everybody should target to handle right away?
I think it's unique to the situation. So for us, in the first few days, I said, well, there's a safety issue because he's forgetful and he's unsteady on his feet. Forgetting the cane is really important. And how do we solve for that? But also, from a medical perspective, not having the proper nutrition and not eating the right things could put him in a really bad medical situation as well. So those are the two areas that were really important for us. And that might be a little different for other families.
Mm-hmm. So it sounds like a good question somebody could bring to the doctor when they're visiting of what is the top 2 or 3 things that need to be solved right away to help people knowing what questions to ask.
Right. And it's just that, Katie, it's the top 1, 2, maybe 3, but it can't be a list of 10, right? Because that gets really overwhelming.
And how do you personally balance having a career while also helping out with your loved ones?
I think being intentional, right? And knowing that I'm not there, so I can't hold too much of the sense of guilt, and I can contribute in ways that I can. But being really intentional about, can I check in every other day? I'm in charge of appointments and the grocery order. That's a once a week thing, right? And so making this space to be able to circle back and complete it for them is probably the way that's most helpful.
And so it's been a bit of time since the holidays, a few months. What is the biggest shift that you've seen from what you were experiencing when initially navigating this with your family to where it's at now?
Yeah, I think my brother and I have better coordination, and we have enough of a plan in place to keep them safe, and we're holding off on that last piece. We reintroduce it every so often to see if it's time, if she's ready to consider having a caregiver come in for personal care. So we have some options in our back pocket for when she's ready, and we've got really good coordination. And I think she feels more open to sharing now, sharing more detail about the day to day, what's happened, that's new, that's different, that's concerning. She may have, or maybe I wasn't listening right. She may have held back on some of those details in the past.
And what is some advice that you would have for others that are experiencing what you're going through right now?
I would say your parents don't want to bother you, right? You're living your life and you're busy and maybe you have a career and children or other things, and they don't want to be a burden. So sometimes you just got to lean in a little bit deeper to really know what they're going through. And so I had that opportunity through this extended visit. And it may not always be the case. Maybe it's just spending an evening, right? Not a quick dinner where you're in and out, but maybe a little bit longer to see, well, how do you manage the medications? And how do you, manage the nighttime routine? Or I don't know, different questions just to see if they're okay when everybody exits the home.
Yes, it's definitely, there's a need to check in and see for yourself what people are going through. And I think for your situation, that was around the holidays. And that tends to be a time when a lot of people start to notice what is going on with their families. Do you have any bit of encouragement for somebody who is in your situation right now?
Sure. I would say they're still your parents, and all the efforts that you're going to make to try to be helpful is coming from a place of love. And so if it causes maybe a little rift for a little while, be patient and circle back and just continue to keep their best interests front and center. And it will go a long way. It will take time, but it will go a long way.
Yes. Well, thank you so much for joining us here today and sharing your story and some advice for what other people can use that are going through the same similar situation.
Thank you so much. It's been a pleasure.
And this is There for Care by CareScout. Be sure to like and subscribe, and we will see you for our next episode.